This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. We're at the Aurora Medical Center in Oshkosh today. We're actually on the third floor of the medical center, the new home of the Hyperbaric Wound Care and IV Therapy Department. Now today we're going to be talking with registered nurse Angie Ahrens about the new unit, the expanded facility, and a little bit more about IV infusion. Well, thank you for joining us today. For a lot of people, they might be confused as to what IV infusion is. So can you just kind of give us a little bit of a description of what IV infusion is?
IV infusion is when you receive a medication intravenously through your vein. And we do this on an outpatient services. Most people are familiar with it on an inpatient service when they're hospitalized. But here at Aurora, we offer it on an outpatient basis.
Now, when you're talking about the IV infusion, you're talking about, getting medicines into the body. Mm-hmm. Is it something that takes a long time?
It depends on the type of medication that's being infused. The only medication we do not infuse here would be a chemotherapy agent, but we do use certain chemotherapy drugs to treat different diagnoses such as rheumatoid arthritis. An average infusion can last anywhere from 30 minutes to 2.5, 3 hours.
And how often does a patient typically have to go through that?
A lot of times if it's an antibiotic infusion, we will see them daily for up to 6 weeks. Sometimes we do get some people that need blood transfusions, and then we'll only see them on an as-needed basis. And those infusions can take anywhere from 2 hours to 6 hours, depending on the amount of blood needed.
Angie, I understand we're on the third floor of the medical center now, and this is a brand new facility for you.
Right. What we've done is we've expanded our IV department. We're no longer a 4-room department. We now have 6 rooms and a multi-place room, and each chair or unit has a privacy curtain, private TV. It's wonderful settings.
Yeah, I would imagine you're able to see a lot more patients then.
We are able to see a lot more patients. Actually, our IV department now is up to 6 patients infusing at once with 2 nurses.
Wow, so you can get more patients in, and I would imagine that means more convenience for the patient as well. You're not waiting around as long to actually get in.
That's right. This allows our patients to be satisfied a lot more because they do not have to wait to get in, and there's more one-on-one care provided with the extra nurse.
Okay, now what if a person is not seeing an Aurora provider? Do you help other people that are seeing people outside of Aurora?
We actually do. As long as we have a physician order, we can take care of any patient outside of Aurora. We actually do infusions on quite a few patients who doctor in Milwaukee.
Okay. Do you provide other outpatient services other than just the IV infusions?
We do. We actually do prophylactic treatments for patients who are receiving CAT scans. We also do therapeutic phlebotomies, and we do cosatropin stimulation tests, which help doctors diagnose different conditions.
Okay. And just going back to this new unit, it's the old PEDS unit, I understand.
It is the old PEDS
so
unit.
It's kind of fun up here. What's the setting like here when people come in if they've never been here to the IV infusion unit?
The setting is very calm. That's one thing we like. It's very quiet up here compared to downstairs when we were part of the emergency department. It's also kind of fun too. Our patients do like the pediatric themes that we have throughout the unit. So it is, and actually one of the main compliments we get is our nurses station, which is a big airplane. So it's fun.
Now, Angie, just walking through this unit, I know that you do much more than IV infusions. You have some terrific equipment up here to help people.
Yes, we do. Actually, our IV therapy, we're part of one unit. We also do hyperbaric therapy and wound care. And many times we combine all of the therapies together. Sometimes we'll have a patient in the chamber receiving IV infusions at the same time, or we're having a patient who's receiving long-term wound care and we're infusing them with IV medications at the same time. So we offer multiple services in one department.
If you have any questions about IV infusion or hyperbaric wound care, you can call the Aurora Medical Center at 920-303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.